It's 2:10 p.m. here in Seoul. I'm Yoon Jung-min at the Arirang News Center. We are breaking into our regular programming for a live briefing from the South Korean health authorities on the coronavirus outbreak. The briefing is just about to start. Listen in.
네, 2월 2일
Let us now begin our regular briefing on the COVID-19 situation here in South Korea for February 6th, Saturday. As of today midnight, we have 296 new local infections, and we have 41 domestic cases, and the total caseload now stands at 79,524. Currently, we have 8,444 people in quarantine, and we have 244 people in critical or severe conditions. We had 10 additional fatalities. I extend my deepest condolences to the deceased and the members of the bereaved families. And here are our major updates of domestic infections nationwide. We have 366 new local infections, and by region we have 274 in the metropolitan area and 92 in the non-metropolitan region, 33 in Chungcheong area, 14 in Honam area, 22 in Gyeongbuk area, and 26 in Gyeongnam area, 1 in Gangwon-do province, 6 in Jeju Island. Compared to the previous day, we are seeing a decline in the number of daily infections. However, we still have many cluster infections stemming from day-to-day venues, including our restaurants, as well as office spaces and indoor gyms. And by region, we have in the metropolitan area in Gangbuk-gu district, in relation to a sauna in Seoul City, we have 12 additional cases, and in total, we have 27 cases being confirmed to date. And in Seoul Seongbuk-gu district, in relation to a university, we have 7 additional cases, raising the total to a total of 80. And in Seoul Junggu district, in relation to a welfare facility, we also have 5 additional cases being confirmed, and in total, we have 83 cases. And in Seoul's Gangdong-gu district, in relation to an oriental hospital, we have 3 additional patients being confirmed. In total, we have 23 patients being confirmed. And in Gyeonggi-do province, Namyang-ju city, in relation to a second nursing home, after the 3rd of February, we have identified 2 additional patients. And in total, we have 18 patients being confirmed to date. And in Incheon city, in relation to a trading company in Yeonsu-gu district, we have 2 additional cases being confirmed. In total, we have 15 cases being confirmed to date. And in Chungcheong-do area, in relation to also a factory there, we also have 2 additional patients being confirmed, and in total we have 17 patients being confirmed. And in Honam area, in relation to an Gwangju Seogu District Church, we have 2 additional cases, raising the total to 130. And in Jeju Island, in relation to a third family gathering, we have identified the first index case on the 4th of February, and we have 7 additional patients being confirmed, and in total, 8 people have been confirmed to date. And in Gyeongbuk area, in Daegu-dongbu area, in relation to a fourth family gathering, we also identified 6 additional patients being confirmed, and in total, there are 7 people being confirmed to date. In Gyeongnam area, in relation to Busan Seogu district, in relation to the Port and Transport Workers Union, we have identified 2 additional patients, and a total of 51 patients have been confirmed to date. Recently, we are seeing continued cluster infections stemming from saunas and public bath areas, and we would like to give you some recommendations as well. After October last year, we have seen related cases. About 24 cases have been breaking out. 12 in the metropolitan area and 12 in the non-metropolitan area have been taking place. And we have analyzed the major risk factors, and we have identified that most of these places were underground, meaning that they had poor ventilation, and they had people staying in poorly ventilated ventilated areas for a very long time, and also they had group meals and gatherings, and this also had a high risk of infection. And in order to prevent further infections stemming from saunas and public bath areas, we ask all of the managers to direct the users to wear face masks at all times, and also disinfect the area on a regular basis. And moreover, the users also need to minimize their time of stay, and at the locker rooms they need to wear face masks and also refrain from engaging in dialogue or consuming food. Moreover, lately we have seen the spread of local cluster infections, and we believe that many people are being attentive to the new variants that are being identified here in South Korea. Here are some updates. Lately, we have identified and analyzed 56 samples of inbound travelers, and we identified 12 additional new variants. And out of these 12 people, 3 have been identified at the places of entry, and the rest of 9 have been identified to be contagious of the virus after they were on self-quarantine. And as for the people who had contacts, we have identified no cases of local transmissions, and we have also identified 2 more people who have tested positive by sitting in the vicinity area at the airplane. And we also have identified, currently carried out testings and put these people on self-quarantine as for the family members, and also 1 person who has come to contact. And to this end, the quarantine authorities are looking into these samples, and we are conducting our genetic sequencing analysis. And there are a total of 30,000 analyses that can be carried out, and we are carrying out all of these processes. And we have identified 51 new variants that have been identified so far here in South Korea. And we had 37 of UK variants, and 9 South African variants, and 5 Brazilian variants. However, identifying these new variants is very different from the COVID-19 test kits. Currently, the COVID-19 test kits utilize the specific genes in the samples, and this is a very unique process, and we can identify the results in a very limited time, and it is very efficient to use. However, these genetic sequencing analysis is very different from these test kits. We need to analyze each and every one of the 30,000 genes, and it is very time consuming, and it can be only done by professionals. So we once again would like to highlight that this specific analysis is not a diagnosis. However, it is a very scientific approach in analyzing and assessing the results. Therefore, these analyses cannot be carried out at any laboratories. However, they can only be carried out at restricted and very high-tech equipped laboratories. And here in South Korea, we have a limited capacity in analyzing these analyses. And however, we are also on parallel with other countries when it comes to these kind of technology. And we would like to bring you some updates on the antibody therapeutics that we have developed, and the Recunorazou will be supplied to the medical facilities starting from February. And this will be also administered to the patients, and we will be providing these targets of the patients, the target of the patients based on the experts and the professionals' point of view. And we will be also cooperating with the local health health clinics as well. And currently, we are also among the ages of over 65 and those with mild and to moderate symptoms. We have seen that this has been proven to be effective, and we sincerely hope that this could alleviate these symptoms. And currently, the WHO has identified 82 countries have identified and detected the new variants of the COVID-19. And to this end, the Korean authorities also like to intensify our quarantine against the new variants stemming from the UK, South Africa, and Brazil. And to this end, we are also intensifying quarantine measures for all of these people who are traveling from these three countries. And going forward, we are also analyzing the samples of 10 to 20% of all of the entrants from these countries, and we will be intensifying our measures as well. And during the upcoming Lunar New Year holiday, we believe that the quarantine authorities have a special and have more sense of duty. And in the metropolitan area, we hope, and we have seen in the non-metropolitan area, we have seen our daily cases drop to 2 digits. However, in the metropolitan area, we are seeing a very slowdown trend in the decline. And as mentioned earlier, stemming from saunas and public baths, as well as restaurants and workplaces and gyms, we also see many cluster infections breaking out sporadically from day-to-day venues. And in the non-metropolitan area, we have been easing the business operation restrictions from 9 p.m. to 10 p.m. And this is aimed at alleviating the difficulties that are incurred by the self-employed. However, it does not facilitate and promote the people to meet more often. And we believe that meeting people could also spike the risks of infection, and we ask you to take particular precautions. And as for the business owners, we ask you to ventilate and disinfect your places on a regular basis. And we ask all of the users to also wear face masks at all times if it's possible. And as for the vaccine inoculation, we also have a very hopeful news, and we sincerely hope that we can return back to normal. The quarantine authorities will also make sure, and we will have a robust quarantine measures, and we will also exert our full efforts. Thank you very much.
That wraps up our coverage of the briefing this afternoon. Thank you for staying with us. We will be back with our regular newscast at 6 p.m. Korea time. Goodbye.
There's been a drastic drop in blood donations due to COVID-19, and the cold weather is not helping.